Welcome to Accessible Pittsburgh. This is ongoing programming to inform the community and residents about initiatives and programs offered by the City of Pittsburgh, Department of City Planning, and the City of Pittsburgh Allegheny County Task Force on Disabilities. I'm Dr. Roy Cox, District Chief and Patient Care Coordinator with the Bureau of Emergency Medical Services, as well as the Operations Director for the Critical Incident Stress Management Team. I'm also a board member of the American Red Cross and an active member of the City of Pittsburgh Public Safety Department. I am joined here today by James Chris Noskasey, a member of the Pennsylvania Rehabilitation Advisory Council and a member of the City County Task Force on Disabilities. He is also an educator at the Western Pennsylvania School for the Deaf for the past 35 years.
Thank you, Roy. I'm glad to be here today.
We're here to talk about a new city initiative to provide police and paramedics with first response communications book, which is a product of Widget Health. Widget Health is a British company that collaborates with health professionals to produce products and create symbols that provide communications support for patients who have communications needs. Chris, can you tell us more about the First Response Communication Book?
Sure, Roy. The First Response Communication Booklet is designed to help first responders to medical emergencies to ask questions and understand responses from people for whom communication is difficult. The first responders include paramedics, doctors, nurses, community first responders, clinicians, firefighters, and police officers. The symbols contained within the book are an effective communication tool to enable dialogue with people that have learning disabilities, people who do not speak English, and people who are deaf and hard of hearing. However, the book is an important communication tool that can be used even before emergency situations arise.
Chris, can you elaborate how the book works in practice?
The first responder points to symbols contained within the book to add meaning to any questions posed or statements that are made to the patient. The patient can respond by pointing to symbols. This heightened level of communication benefits both parties. The responder can quickly and effectively gauge the nature of a serious medical situation, and the patient is also able to quickly and effectively communicate any urgent information to the responder.
It is indeed a great tool for first responders and patients alike. What is the layout of the book?
Medical situations normally progress from first contact to diagnosis and then to initial treatment. The layout of the book mirrors that progression. The core sections of the book follow the medical assessment mnemonic SAMPLE, S-A-M-P-L-E. S stands for symptom. A stands for allergies. M stands for medication. P stands for past medical history. L stands for last oral intake. And E stands for event history. In addition, the back of the booklet provides easy access to a pain scale and to core responses such as yes and no.
Well, let's look at the pages of the book more closely. And for example, the first pages serve as an introduction to the responder and to the patient. There is an About Me section, a risk assessment section, which enables the responder to learn of any potential dangers, and an I Am Here to Help section, which enables the responder to gain some initial information pertaining to the patient. The next pages provide a body diagram along with symbols that help the patient describe the symptoms they are experiencing, such as those related to pain and feeling ill. The next pages that enable the patient to relay information pertaining to allergies, medications, including such things as the dosage amounts. Then we have symbols that relate to the patient's past medical history and the last oral intake of food or drink. Next, we have pages that relate to the event history, which is key to enabling the responder to understand the nature of the emergency situation. Next, we have the pages that include questions and symbols pertaining to what the patient is doing and what event happened and exactly how it happened and unfolded.
The book finishes with symbols related to treatment, contacting someone close to the patient and relaying what happened or what happens next in the situation at hand, such as whether someone is going to the hospital or if they're going to see a doctor, or not to worry about what happened. The last pages include symbols pertaining to the core responses and the pain scale.
We feel this is a helpful tool and much needed addition to our ability to help Pittsburgh residents and visitors with medical emergencies. For more information regarding the book and to view the book's contents, please visit the Widget Health's website at widget-health.com/first/responder/communications/book.htm. For more information about Pittsburgh Bureau of Emergency Medical Services, you may go to pittsburghpa.gov/EMS/ or call 412-622-6930.
And you can find out more information on the city, county task force and the City of Pittsburgh's ADA coordinator at pittsburghpa.gov/DCP/ADA, or you can call Richard Meritzer at 412-255-2102.